need to take a roll call for the meeting. This is Charlie Klippel here.
Okay. Paul Philpott.
Here.
CC Woods.
Here.
Thomas McNeil.
Here.
Graham Rader.
Here.
Victoria Valtry.
Good morning, I'm here.
Morning. Steven Hernandez. Matthew Brackman.
I'm here.
Commissioner Deidre Gifford from DSS. Is anybody representing DSS today? Claudia Galtieri on behalf of Secretary Melissa McCall from OPM.
Here.
Thank you. Sean King from OHA.
Good morning, I'm here.
Good morning. Yvonne Addo on behalf of Acting Commissioner Nancy Navarrete from DEMAS.
Good morning, President.
Good morning. Paul Lombardo on behalf of Commissioner Andrew Mays, Connecticut Insurance Department.
Here.
Good morning. Thank you. Commissioner Manisha Jutani, Department of Public Health.
Good morning, Heather Aaron, DPH for Commissioner Jatani.
Thank you so much. Appreciate it.
Okay, I think that's everyone. Thank you. Could I just remind the management folks on the call to introduce themselves when they speak? So next order of business is to approve the minutes of the last meeting. First, any comments on the minutes of the last meeting? If not, then I would ask for a roll vote on approving them. And again, Charlie Klippel, yes.
Okay. Paul Philpott.
Yes.
Don't we need a motion? I'm sorry, don't we need a motion?
Oh, sorry. Good point.
Sorry.
Can I take that as a motion?
This is Vicky, I'll move it.
Perfect. Thank you, Vicky. Very good. All right. With that motion, then let's take the vote. And again, Klippel, yes.
Okay. Paul Philpott.
Yes.
Claudia Galtieri. Deidre Gifford.
Yes. Oh, sorry.
Deidre Gifford. Graham Rader.
Yes.
Sean King.
Yes.
CC Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Valtry.
Yes,
And Matthew Brackman.
Yes.
Thank you.
Thank you all. The next is to appoint two ex officio members of committees. And Manchin, if you would just remind the group and me the two appointments we're making, that would be helpful.
Okay. It's a motion to permanently appoint a commissioner of the Department of Mental Health Addiction Services to be an ex-official member of the Audit Committee, and to permanently appoint the commissioner of the Connecticut Insurance Department to be an ex-official member of the Strategy Committee.
So I always stop at the word permanent, but it's all right. We'll use it in this context. And again, Vicky, I'd ask if there's no comment on this, if you'd make a motion.
I will make a motion to make those appointments.
Thank you.
Thank you.
Tom
Second.
McNeil, seconded motion.
Okay.
Perfect. Again, I think you need a roll. So Klippel, yes.
Okay. Paul Philpott.
Yes.
Claudia Galtieri. Mr.
Yes.
Galtieri. Thank you. Deidre Gifford. Graham Rader.
Yes.
Steven Hernandez. Sean King.
Yes.
CC Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Valtry.
Yes,
And Matthew Brackman.
Yes.
Thank you so much. Motion passes.
All right. Thanks again, everyone. And so, James, the floor is yours.
Thank you, Mr. Chairman. Good morning, all. I'm James Michel, the Chief Executive Officer at Access Health Connecticut, and welcome to our November Board of Directors meeting. Before we begin with our planned agenda, I would like to acknowledge the good news I shared with the board last week. As you know, the Council for Affordable Health Coverage and the Health Benefit Institute conducted a joint survey to assess the online customer experience for all public exchanges. The report was released this month, and Access Health Connecticut was ranked #1. Washington State was 1 point behind us. We came in with 95, and they came with 94. After that, there's a big drop off. This is particularly meaningful right now since we've completed many enhancements to our website in preparation for open enrollment. Recognition from these two independent organizations is also compelling in that they are focused on addressing the rising costs of healthcare in our country and the ways that Americans can make informed financial choices that best meet their needs. I'd like to thank you, our board of directors, for providing the guidance and leadership so that we can fulfill our mission. And I'd also like to thank our entire organization, everyone involved, and particularly Robert Blundo and his team, along with many others at Access of Connecticut that worked every day to make it easier for Connecticut residents to choose a health insurance plan that is best for them and their families. We do what we do every day to improve the quality of life of Connecticut residents by ensuring they have access to affordable health insurance. That is our main objective. However, it is nice to be recognized for the quality of our work. Congratulations to everyone here that has been part of this process. In our ongoing efforts to better serve Connecticut residents and fulfill our mission, we are making progress with our strategic initiatives. Last week, the Strategy Committee was informed about our plan for the Broker Academy in detail. It was a robust presentation, met with enthusiasm and appreciation for deeper context. Additionally, we continue to work on the framework for the subsidiary and are working through our future growth and success plan. These two strategic initiatives are closely linked as we look toward our future to help address health disparities in Connecticut and making sure we have the appropriate people in the right places to execute our strategic initiatives. As we continue to work on our project plans, we will be working closely with the Strategy Committee of the board to incorporate their input and guidance. When we have a final work product to share, we will come to the board and inform you about our progress in more detail. Our agenda today includes the following. First, you will hear from Susan Richby, Director of Legal and Government Affairs, about our procurement policy. This is a change that we would have to make, adjustment on document practices that we have been doing, but they have not been part of the policy. So we have to go make it official. So Susan will briefly discuss that. After Susan, Rob Blundo, Director of Technical and Operations and Analytics, will provide an update on our 9th open enrollment. We will then transition to a marketing update by Caroline Lee Ruette, our Director of Marketing. Caroline will provide an update on our past, present, and future efforts to raise awareness about the Covered Connecticut program and provide an overview of our open enrollment advertising campaign. Then Tammy Hendricks, our Director of Health Equity and Outreach, will provide an update on our recent efforts to meet Connecticut residents where they are in our communities throughout the state. Then Darrell Jones, our Director of Finance, will then present a budget in our finance report, which will require several votes. Susan will then come back and provide an audit committee update, which met last week to receive the fiscal year 2021 audited report from our independent auditors, Clifton, Larson, and Allen. Susan will continue with a legal and policy update. Let's see a quick update on what's going on in DC with respect to Build Back Better and potential impact to us and our customers. While we have much to discuss, I'd like to conclude with my deepest appreciation to the members of our board of directors for their continued support. I will now pause for any questions. Thank you.
Any questions? So James, I'm just gonna, oh, sorry, yes, please.
Oh, sorry, Charlie.
No, go ahead, please, Vicki.
I could not navigate to get to the raise hand.
These buttons are, yeah, please.
I just wanted to say I watched press conference yesterday. I thought it was really well done. Commissioner Giuthani, I thought, did a great job outlining the importance of people getting enrolled in health coverage. At the same time that we were talking about the excellent report that came out. So first of all, congratulations on that. And secondarily, a great job at the press conference.
Thank you much.
Yeah, here. I would have, that press conference was a nice victory lap for the governor as well as for Access Health. But I think that one point about that survey was that it showed this significant increase in the ranking of Active Health, Access Health over a 5-year period. And that was reflective of a lot of hard work. So I think everybody on this call, or many of you by email, congratulated the staff, but they did a fantastic job, it seemed to me, of getting to achieve that that result. So congratulations again to everybody.
Thank you much, Charlie. And Charlie, we are working on doing even better, more for our customers. So more to
Put some
come on
open
that.
water with Washington, apparently.
More to come on that.
It's all good.
Thank you all. Thank you.
All right. Any more comments? If not, then
May I
we will
say
move-
just one thing? I'm sorry.
Yes, please.
Sorry, I just want to say you all have been doing the hard work. We just were there to highlight it. So we just wanted
Thank
to
you.
emphasize it. Thank you.
Thank you.
Yes, thank you. Agreed about who does the work versus who gets the credit is often. But all good. Thank you. So I think it's Susan is up next to talk about procurement policy and to ask for a vote on the policy.
Thank you, Mr. Chairman. Susan Richby, Director of Legal and Governmental Affairs. And today I'd like to present to you some proposed revisions to our procurement policies. We have 2 procurement policies that you should have all received the copies of the proposed revisions, and they are on procurement of goods and services. So just to give you some background of why we are proposing these revisions, in our FY 16-17 annual audit report from the Auditors of Public Accounts for the state of Connecticut, there was a finding and recommendation that the exchange's procurement policies were broad and lacked criteria for determining appropriate reasons for awarding sole source contracts. In both of the policies for procurement of real and personal property and also for personal services, it provides that contracts shall be awarded by the exchange in such manner, including the basis of sole source procurement, as the chief executive officer determines to be appropriate and in the best interest of the exchange under the circumstances, provided that in the case of any contract for personal services requiring an expenditure of over $75,000 during a 12-month period, or for a particular project, wherever possible, that the contract be awarded on the basis of a competitive process, which includes the solicitation of proposals from at least 3 parties, 3 qualified parties. So as James mentioned, we have been following in practice certain requirements for any sole source procurements, but it was not, the language has not been part of our procurement policies. So following on the recommendation of the state auditors, we are proposing to make a revision to those policies, and you've received the documents in 4 categories, outlining the 4 categories that we would permit the sole source award of a contract. And that would be immediate need or an emergency situation, services that are needed in 3 weeks or less, or are required due to an emergency that exists that will adversely affect the exchange's operations. Specialized skills and services for which there is only one documented accepted service, such as transactions involving vendors that have unique services or skills due to the existence of patents or certain proprietary rights. Unusual conditions and contingencies, purchases because of unusual conditions or contingencies that could not be reasonably foreseen, or because of unusual trade or market conditions. And then finally, in the instance that we may have issued a request for proposals, but we've received less than 3 proposals, maybe we received 1 or 2. So the procurement under those circumstances, even though we've done an RFP, is considered to be a sole source procurement because there are not 3 qualified bidders. Also, you'll note in the documents in the procurement policy for personal services, there's 2 very minor revisions, adding the word professional in the heading for the professional services section, and also deleting affidavit as to with regard to Connecticut General Statute Section 4-252 to make an update for a change that was just passed during this legislative session in 2021. So the staff requests that the board approve posting of these proposed revisions in the Connecticut Law Journal for 30 days of public comment prior to final review and adoption. As a quasi-public agency, that is the process that we follow. So if the board is in favor of proceeding with these proposed revisions, once there is a vote, we will post it in the Law Journal for the 30 days of public comments. Then we review any comments received, and then we'll come back to the board with the final revisions for adoption. So I'll pause for any questions.
Thanks, Susan. If there are no questions, then again, I think we need a motion to approve these changes and a vote.
Mr. Chair, I think we'll have to spell out the motion. Thank you.
All
Yes,
right.
I'll make the motion. This is Vicky. I'll make the motion to approve the proposed revisions.
And if I could get a second and then mention, just read the motion for us.
Chair will request a motion to approve posting of the proposed revisions to the procurement policies in the Connecticut Law Journal for 30 days of public comment.
Perfect. All right. So then we have a motion.
I'll remake it just to make it official. I will remake the motion to reflect exactly what Marcin just read to us.
Thank you.
And I'll second. Oh, sorry.
Okay. So I have a couple seconds. Thank you. Charlie Klippel, yes.
Okay. As there, Commissioner Tutani, DPH is a non-voting member, so I will need to get the second from the voting member of the board.
This is
That was
Paul, I second.
Oh, Paul. Sorry, Paul.
Both. Okay. Thank you. And a roll call. Charles Klippel,
Yes.
Paul Philpott,
Yes.
Claudio Gualtieri,
Yes.
Dietrich Gifford, Grant Rader,
Yes.
Cece Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Valtri,
Yes.
and Matthew Brackman.
Yes.
Thank you so much. Appreciate it.
Thank you again. Marcin, your navigation. Oh, perfect.
So Rob, you're up, Rob. Rob Blunder is going to walk us through an update for the open enrollment.
Certainly. Good morning, everyone. I'm Rob Blundo. I'm the Director of Technical Operations and Analytics at Access Health. I'll be providing an update on open enrollment today. We are now nearly a quarter of the way complete with this open enrollment period. I wanted to provide a brief update on some of the key metrics in terms of how this open enrollment is starting to look this year to the board. So as of last Monday, we've processed over 10,000 2022 enrollments so far. As a reminder, these are manual enrollments. These are folks who've actually come in and manually enrolled into a 2022 plan. We have about 96,000 2021 enrollees who have yet to be renewed. And additionally, there's over 5,000 residents who were determined eligible for Husky plans during this timeframe since November 1st. In addition to that, traffic on the site has been trending about 9% higher than last year at about 82,000 visitors, while our call center volume is about 29% lower than last year at this time. So this is a pretty remarkable stat. This is the fourth year in a row that we've seen our call center volumes. And just to clarify, our call center volumes, I'm measuring calls offered versus calls handled. So calls offered are regardless of whether the individual actually made it through or not. That is the volume we are seeing. It's the fourth year in a row that we've seen that actually decrease, despite the fact that there's higher volume either on our website or similar volume on our website application enrollment activity. So this is, once again, I think this is a sign of continued dividends from the investments we make in process and technology to really promote self-service across consumers and make sure that we're closing out applications and enrollments on the first try. Also, the board may recall Access Health has been sounding the alarm on staffing challenges we've had approaching this open enrollment period with our call center. While this continues to be a challenge, I'm happy to say that the performance since November 1st continues to improve. We're gaining additional agents as they complete training, and we're also weathering volume surges. So to put this into context, our average call center wait time is currently hovering around 7 minutes, and our call abandonment rate is at about 8% currently. Both averages continue to trend downwards, and they're significantly lower than the first few days of open enrollment period. So things continue to get better. We're working hard to make sure that we continue to get those averages down as far as possible. With the pandemic still in effect, our in-person and with the pandemic still in effect, our in-person assistance channels and support channels continue to operate as an ancillary option for consumers. We have over 70 visitors to our enrollment centers, 200 RSVPs to our healthy chats, and 100 attendees to our enrollment fairs. Tammy will be covering this in a little bit more detail shortly. And then before I dive into some specific metrics related to open enrollment, I want us to just pause and remind folks that we have an upcoming major event that's around the corner that will impact a large portion of our consumers. So until November 23rd, our system will be processing automatic renewals for about 64,000 households. This equates to roughly 80,000 enrollees or so who've indicated that they prefer to be automatically renewed into the plan that they chose for 2021. Those consumers will still have an opportunity to change plans either before or after that auto renewal and all the way through until the end of open enrollment. However, if they take no action, they'll still be covered in 2022. They'll just keep the plan that's been crosswalked from 2021. And then for the remaining 13,000 households who've indicated that they'd like to manually renew or don't qualify for automatic renewal, once again, once December starts and those auto renewal activities are done, we then really start our retention campaign that's focused towards them, to really make sure they understand that if they don't take any action, they will go without coverage either for January of 2022 or 2022 entirely if they don't take enrollment action between December 15th and January 15th. On the next slide, we have some year-over-year metrics comparing open enrollment for this year so far compared to the same exact time frame from last year. So one caveat before I dive into these, it's still very much very early in the open enrollment period. We're in the midst of a public health emergency. There's a lot of variables here that could impact things as we compare from this year to last year. So just one caveat there to consider. Diving into these specific metrics regarding acquisition of new enrollees and retention of new enrollees, we've acquired about 2.2 thousand new QHP customers and renewed about 8,400 so far. In comparison to last year, it's about 20% lower than we've seen year over year. For those that are wondering why we think those numbers are actually lower than last year, I think there's two factors to consider. The first one is we're coming off an extended special enrollment period since May. So essentially from May through October, we basically had the equivalent of an open enrollment period. We had a qualifying life event where anyone who wanted to take advantage of ARPA, anyone who had lost coverage or were impacted by being uninsured could essentially come in and enroll. In addition to that, there's, and this is arguably the bigger driver, we're in the midst of the public health emergency. That PHE or public health emergency prevents individuals from losing coverage in Husky for some of the most common reasons, like changes in income, particularly increases in income. So to date, there's about 190,000 Connecticut residents that are benefiting from this extended coverage. And those individuals traditionally account for about 10% of our enrollment. As they transition off Husky, they roll into a QHP plan. We obviously don't have that during this public health emergency period. Despite all of this, we currently are seeing about 8% higher enrollment than we did last year at this time. Not during the November 1st period, but total enrollment before we even started the enrollment period, we were about 8% higher. So this should still serve as some version of an increased demand and some success that we're having in terms of retaining and capturing residents into the individual market. A few other metrics I want to cover. As you might expect, the eligibility for premium tax credits has increased about 10 percentage points compared to last year. That's primarily related, and as you might expect, to the American Rescue Plan. At this point, folks who are ineligible for that financial help would primarily be related to individuals who have income that is greater than 8.5% of their, their premium is greater than 8.5% of their income, or consumers who are declining financial help. And again, as we discussed in the past, the financial help question, we've revamped that screen. We'll be doing outreach to individuals, reminding them of the importance of answering yes to whether they would like to qualify for financial help and essentially not making assumptions that they don't qualify. The percentage of enrollees changing plans compared to last year is about 7% higher. Again, this might be related to ARPA. I think as folks get additional subsidies, the big question becomes, can they upgrade their plan? Can they get a richer plan, for example, for minimal difference in cost, and then ultimately reduce their out-of-pocket cost share? So that's just a trend I'm hoping to see continue to increase during the open enrollment period as folks come in and evaluate options. And then lastly, consumers utilizing brokers continue to increase. So we're seeing that about 51% of our enrollees are associated with a broker, which is a slight increase from last year. On the right-hand side of the slide, we've got a couple of additional observations. We now have our third carrier known as Chi-Chi, which is part of Connecticut. So far, we've seen about 10% of our enrollment for 2022 is falling into the Chi-Chi plans. These are likely individuals that I think it's two sources. Number one is we know that there are off-exchange customers that are enrolling into that Chi-Chi plan because it's very much similar to their off-exchange plan, but allows them to take advantage of subsidies. That Chi-Chi plan is also the second lowest cost silver plan. So in terms of price competitiveness, it's still fairly competitive. So we certainly expect to see consumers continue to enroll in that. Regarding user feedback, I just wanted to call this out. So for the last 2 weeks, we've been measuring enrollment feedback, and this is a survey that's conducted once an individual completes their application and enrolls in a plan. This would be the equivalent to you having your shopping cart, you complete your purchase, a retailer gives you your order details, and then they ask you how your experience was. This survey would be very similar to what that is. 75% of our customers have indicated satisfied or very satisfied with their online experience. The remaining 24%, we're reviewing their feedback. So we can get detailed feedback from those 24%. We're trying to see where we can improve to make sure we can convert them over to satisfied or very satisfied. And then lastly, I just wanted to call out one last thing here. So we are approaching the bulk of our customers receiving communications about their renewal. That was related to the automatic renewal. I think it's important to just call out that the premium change for our existing customers is obviously something that's going to be very much important for our consumers. With that said, nearly 45% of our customers will see either no change or reduction in their net premium if they automatically renew into their 2022 plan. Given the dynamics of ARPA, most of those increases consumers will see will likely be related to either a change in the essential health benefit portion of their plan, or if they lost, let's say, unemployment income because of the ARPA benefit, or if their income from the federal hub that we use to determine premium tax credits has changed. In that scenario, their premium tax credits might change as well. But that's just a general view of what it'll look like from a consumer's perspective. We'll have a more detailed dive into that as we get a little further into open enrollment and we complete those auto enrollments. We'll actually be able to segment the population into how much of an increase they actually observed. With that, I will pause in case there are any questions. Thank you.
So, Rob, this is Paul. I've got a question for you about qualified for financial assistance. Historically, about a quarter of the folks have been paying their own premium. I think that's accurate, right?
Correct. It was actually going up to about a third, Paul, but you're close enough.
Yeah. So the OE8, I see a 77% number, and then OE9, 88%. So, but what I'm trying to figure out is, how many folks were enrolled paying their own premium, and because of new legislation and whatnot, they're now getting a subsidy. If I look at the difference between 77 and 88, is that 11% number, does that help me get to find out what I'm kind of pecking at here?
It does, Paul, it does. So there's a couple of things. There are individuals who qualify for premium tax credit, and then there are individuals who actually request financial help, and then there are individuals who actually qualify for financial tax credits and then don't select to actually receive them. So there's a couple different flavors of that. The 77% that you're seeing is individuals across the entire population, whether or not they have requested financial help or not is immaterial. So what we're doing is we're looking at the entire population and we're saying how many of them actually received something above zero for premium tax credits. I hope that's clear. I could reword that for you. I'm not sure I did a very good job of explaining that clearly.
No, but and that number's 11% higher this year, right?
Correct. 10%.
Okay.
Yeah, I'm sorry.
Or
Sorry.
10%.
Yes, 11%. My apologies. Yes.
Yeah. So I guess what I'm trying to say is, if you assume we have roughly 100,000 members and that difference is 10%, I'm kind of trying to ask if does that mean then that there were 10,000 people who have historically paid their own premium who are now getting some form of assistance? Is that accurate?
Yes, that's correct. And a large portion of those, a large portion of those were automatically updated back in July when we automatically applied the new ARPA thresholds.
Right. Yeah, and I actually had a couple of happy citizens of the state of Connecticut come and ask me about that, because they did, in fact, back then experience a decrease in their premium. So anyway, yeah, that's good. That's great. Thank you, Rob. I appreciate it.
Certainly. Thank you.
Thanks, Paul. Matthew Brockman has a question.
Yeah, Paul, what is our, and maybe I missed it, but do we have a goal for number of new customers through this open enrollment? And how do we stack up? Like I see the number how we stack up against last year's, but what's our goal for this year's?
Yeah, we're looking to have about a 5% increase over last year. That's our target. So that should put us in the 111, 112,000 range for enrollees. Last year, we closed out with about 107. Like I said, we started this open enrollment period with actually a little 8% higher enrollment than prior year. So I think that's a conservative goal. We'll see where things shake out. Once again, it's hard to predict with the public health emergency. We don't know when that's actually going to end. And some of the dynamics with the economy and everything like that, it's a little tough to actually predict, but I think that's a conservative estimate. I think we'll hit that.
So does that number, that 8% increase, that includes, because you're talking about when the health emergency ends, you're talking about having some of the folks who are on Husky now moving into the exchange, right? Or moving on to the private health plans.
Right.
But I guess when I think about new customers, I think about people who are buying insurance off exchange currently coming into the system.
Oh, I see. So
I'm wondering about that, the population that's either buying it privately or is uninsured right now. And how are we, what is our goal with that crowd?
I think when I put out the target for increased enrollment, those folks by the time we get to the end of open enrollment, it's likely the public health emergency will still be into effect. So that doesn't take into account anyone transitioning from Husky. So by default, what that leaves is likely folks that are either coming off the uninsured category, individuals that are coming off exchange onto on exchange, or individuals who may have lost employer coverage, they moved into state, those types of reasons. The off exchange market itself is fairly small, so I don't think that there's going to be a humongous lift from that side, but that'll certainly help as we start to hopefully transition folks onto the exchange from off exchange to take advantage of those ARPA benefits and just general APTC benefits.
So do we have a goal for that number?
Yeah, the goal I'm referring to is that 5,000. So those individuals, when I reference the increase from last year, I think those are almost entirely coming from uninsured and off exchange. And then again, the general flow that you see in the economy of folks either losing coverage through employer plans or moving in state. So I think that should be a minority of it during the open enrollment period.
So you think we're kind of about halfway to the goal of new customers?
Not well,
or is
not
that 2,000 not actually that same population?
Not necessarily, because we will see attrition during the open enrollment period as well. So that's the only thing I want to caveat. It's not necessarily, it won't necessarily sum out to that. We will have folks who drop off. And again, that's natural. There are folks who are going to get coverage to their employers. There'll be folks that move out of state. So, I mean, we're getting close, but I think we will see a majority of our enrollment come in traditionally the last 2 weeks of the open enrollment period, or the 2 weeks before the December end date for January coverage. So the busiest weeks for us traditionally are between, roughly December 5th and December 15th, and then usually the last week of the open enrollment period, which is traditionally the last right before just January 15th.
Okay, thank you.
Certainly, thank you.
Thank you, Matthew. Any other questions? So, Rob, thank you, and again, congratulations on the achievements recently rewarded. When these numbers develop, I'd be interested in seeing that, particularly if that 31% plan switching number holds, sort of where people are switching to. Are they buying up, buying down, how that's going, and maybe something about how the shop enrollment is going as well. So, but I appreciate it's early days, so we look forward to continued reports.
Absolutely, we look forward to sharing that. Thank you.
Next, I think, is Carolyn Lee.
Yes, good morning. Caroline Lee Ruette here, the Director of Marketing for Access Health Connecticut. It's a pleasure to be with everyone. We're going to kick off our marketing presentation today with an update on the Covered Connecticut marketing tactics and strategy here. So as I provide the talk track, you have a Gantt chart in front of you that will show you, each individual tactic, when it's been in market and if it's going to continue to be in market. And I'll point out a couple of things here. I know that we've spent some time at board meetings talking about where we started. We'll cover off on that pretty quickly here and spend most of our time on where we are today and where it is that we're going. So first and foremost, marketing elements are being created in English and Spanish. It's particularly important for us to make sure that we're reaching all of the folks that we need to and that they're understanding the content. And that includes a robust Q&A, right, that we started with, and that's available on our website, and includes many things, including instructions about how to determine eligibility, how to enroll, and how to find free help. Additionally, we're relying very strongly on organic and paid social media. This has been a big success for us. For example, our September 10th Facebook post alone has garnered 22.8 thousand views to date. And that stat was pulled earlier in the week, so it may well have increased by now. Additionally, the blog post that we have, it's pinned to our homepage of our website. So it's easy to find. It's one of the featured blog posts, and it's more high level, and it links out to that really robust Q&A that's on our site too. That blog post was the highest performing page on our website on November 2nd, meaning that people are finding this information and they're finding it helpful during the open enrollment period. Additionally, you may remember that before our system was automated with the Release 33 in October, we were pulling the eligible customer information manually and sending them direct mailers and emails. We have increased our efforts with a mass media campaign during September and October, and that was focused on informing both our direct audience, right, the folks that we want to be enrolling in this program, as well as the people and organizations that influence them, such as nonprofits and community organizations, as well as the legislative community. The results are in from that campaign, and it garnered 8.3 million impressions across radio, billboards, newspapers, social media, and digital advertising. Lots of eyeballs on this stuff, folks. Additionally, the system was updated right in October, and we have now been able to move away from that manual monthly pull of immediately eligible folks and to be notifying them with information. So that's now being automated, which is great. And as folks have questions or they want to go online to kind of see if they're eligible, they can go ahead and see that now as a result of that release. On top of that, we're now engaging with populations that may be eligible. Okay, so this is that acquisition audience. We're using the data in our system going back 3 years. So the further we go back, the less likely the data is to still be accurate, but it's what we're working with right now. We're going back 3 years in our data, and we're targeting people who are either in that income threshold, that FPL band, and we're also going 10% above and 10% below for some spill. We know that this particular target audience, their income tends to change. And so we want to make sure that we're going a little above and a little below to make sure that we're getting everybody that we can. And we're also making sure that this audience has children that would be of eligible age today. So even going backwards, we're making sure that those children that were in the households that we know about would be, the appropriate age today. This is what we're calling our acquisition audience, and it's a total of approximately 7,200 folks. a little more than that. We are reaching out to these people with direct mailers as well as email if we have them. Have about 3,000 emails, but that corresponds with that 7,200 direct mail data that we have. As a reminder for folks who may not know, we do not require folks to give us their email information, although we highly suggest it. It is one of those things that's, you know, a health disparity, right? Folks might not have that information, so we can't require it. It would be a barrier to entry. That's why we rely really heavily on that direct mail when we need to. Additionally, we are finding ways to integrate Covered Connecticut into our open enrollment advertising, such as digital advertising, press release mentions, paid and organic social media. That continues as part of our open enrollment campaign. And a great example, right, we talked a little bit about the press conference with the governor earlier this week. And I want to make mention that we're also finding ways to integrate the Covered Connecticut message even further into our OE communications. Some examples of that include some advertorials that we'll be placing in multicultural publications during open enrollment. And lastly, Vicki mentioned earlier in the call for those that were on, but we actually set up a hotline recently. This is something that's meant for folks to call if they have questions specific about Covered Connecticut. But I want to mention that this is in addition to the call center, which is equipped to handle Covered Connecticut calls. So I hope that you see, you know, in the Gantt chart in front of you, there's a lot happening in October, November, and even moving into the future to maintain momentum on sharing this very important message. I'll go ahead and pause there. Okay. Now we can move on here to our open enrollment advertising campaign. As is expected, right, this is a really robust multi-platform campaign that we're running right now. Hopefully you've seen some of these elements in market already. We've got digital, search, social media, print, radio advertising, and I want to make mention that both our radio and our TV include streaming. So I know there's been a lot of conversations about, you know, what about the cord cutters of the world? Are we on the Hulus of the world right now? And yes, it does include the major broadcast networks, cable, as well as streaming for both radio and television. We've got a lot of public relations going on right now. We're using direct mail as well as SMS, which is this text messaging service. We're using our email, blog, as well as out-of-home tactics, also known as, you know, billboards, as well as some new elements. So that leads me into what's new this year. I may have mentioned this in the past, but a post TV schedule is new this year. And what I mean by that is typically we buy a flight that we're on for the duration of open enrollment. This year, because the feds came down with a much longer deadline, right, January 15th from the very beginning, we're on for an additional 4 weeks. We were able to strategize and make sure that our paid media was stretching for an additional 4 weeks on top of the 6 that we're usually planning for. TV is an incredibly expensive tactic, and we know that it's really effective. But what we're doing this year is we're actually interrupting those flights. So we'll be on TV for a week or two, then off TV for a week or two, and then back on, making sure that our flight is on TV when we are, in fact, when we usually experience our peaks, right? When people are more likely to take action, right around deadlines for the 15th of December and the 15th of January, making sure that we're on TV, right, the 2 weeks before those deadlines. We've also talked about the fact that billboards are in high demand right now, so it's harder to get on those. We do have billboards as part of our campaign per usual, but we're also looking at different out-of-home tactics. So this year we have a lot of parking lot banners that are in high traffic shopping centers. Think grocery stores, value stores, the Walmarts of the world, things like that. We have several parking lot banners in those key shopping areas around the state. And when selecting where those were going to be, we looked at our uninsured rate map and made sure that we were in places that corresponded. Heavy presence in places like Danbury, for example, for that particular tactic. And then lastly, something else that's new this year is called connected TV and digital retargeting. I know that's a little bit of jargon, and so I just want to take a step back and kind of explain that a little bit. So, you know, a lot of times, you know, as families are sitting around the TV, perhaps more, we've still got the virus out there. You know, the kids might be watching a program on Hulu, for example, while mom's on her iPad, and maybe someone else is on a computer in the same home. There's really great technology available to us for the first time this year that allows us to figure out if that ad is playing on that connected TV network. And if so, we're able to reserve a digital ad on the other devices that are connected to the internet and in use at that point in time at home. And I want to be very careful. This is not an intrusive ad. It's not like if someone's sitting at home gaming, all of a sudden they have a video pop up in front of them. This is where any of the advertising would be on the websites that these people are perusing. Maybe mom's looking at the Current. It'll appear in the margins there if she's reading articles there. And then lastly, we do have some added value, right? This is when we buy in volume. What are we getting in addition to what we're paying for? When we're shelling out a lot, we definitely make sure to negotiate and get a little something extra. In this case, we did secure some advertorials in those multicultural newspapers, which is why, as you know, as we're thinking about additional ways where we can really strengthen the opportunity to connect with our target audience appropriately with that Covered Connecticut message, we want to make sure that we're pulling all the levers that we can and being strategic about that. Right here in front of you, you'll see some visuals of the actual advertisements that we have in market. We're making sure to include the deadlines for December and January, depending on effective coverage dates, right? That's what's kind of new, the little wrinkle this year in terms of the open enrollment cycle. Every year it's got a little something different, so we're making sure to stress that when and where we can, when space permits. You'll also see folks at all different points in their lives, right? We've got some single folks out there enjoying leisure activities. We've got established families. We've got folks that are just starting to establish their families. We learned that in our focus group feedback. Those are the type of visuals that are really resonating with the target audience that we need to reach. And so before we move on, I'll pause for any questions, but we'd like to play both our English and our Spanish 30-second spot. That said, we do have several, right? We've got a couple of public service announcements, one that's a more general message and one that's targeted specifically to those that are uninsured. But before we switch over to YouTube to take a quick watch of those two things, are there any questions that I can field for you all?
Quick question. Do we partner at all with the carriers in terms of advertising strategy?
I am not familiar with any co-op in any of our history, although it's a really good thing to consider, and I will take that back to the team to have a better understanding of what we've done in the past and what learnings we might have. But there's no reason why the carriers couldn't. There's nothing, you know, set up that they couldn't, you know, help support in that capacity.
Hey, Matthew, just so you know, historically, we've always worked very closely with the carriers. Our operations teams, marketing, outreach, we work very closely in terms of coordinating our outreach and marketing efforts so that we don't cancel each other out. We've been doing that since we started, and they know what we're doing. They share with us what they're doing to make sure that there's no overlapping and waste of resources.
Right. I just think they've got lots and lots of many years of experience advertising, is right, and very robust marketing and PR teams, etc. And they stand to benefit very greatly by us bringing more people into the exchange. So there may be an opportunity for additional synergies, working togetherness.
Thank you.
I agree with that comment, by the way. I think that's, and I know, James, you were going to talk to both the carriers about putting a little more effort behind Covered Connecticut specifically. So yes. I completely agree with Matthew on this one. I think that they can be helpful. So it's a great question.
Yeah, this is Vicki. If I could just chime in on that point. I know we're having conversations on Covered Connecticut specifically around partnering with the carriers, because I think we do feel that, Access Health is doing what it can, but there's no point in not using every available resource to enroll people. And that's notwithstanding the fact that we know some people that are eligible for Covered Connecticut may actually be still being on, maybe on Medicaid because of the public health emergency and other things. But I think all the teams together are sitting down and talking about that opportunity.
So just very quickly, at this point, the folks who qualify for Covered Connecticut, they are the hardest population to reach. So this is why our efforts are very targeted. They were working with community-based organizations to trusted partners in the communities. They are the hardest population to bring along because of historical challenges. But that's what we do, and we've been doing this since 2014. So there's no doubt that we're going to be successful at it. But it just takes a lot longer with this particular population.
Charlie, I've got a question.
Sure. Please, Paul.
Thank you. Can you help me understand, from a marketing, communications, branding, point of view, what is the distinction between Access Health Connecticut and Covered Connecticut?
Sure. Susan, do you want to give a quick overview on that?
Sure, and thank you for the question. So, Access Health is obviously the marketplace where consumers can come and enroll in a qualified health plan. Covered Connecticut is a new program made available by the state of Connecticut for certain eligible consumers, and they can only enroll in that program through Access Health Connecticut. And so they enroll and they come in and put their information, as Caroline and Rob have probably mentioned, into the application. The application now has all the full functionality to not only make the determination that they're eligible for the program, but to also show them on the screen if they were doing it themselves, or the call center worker would see it, and in their notices to make them aware that, oh, you're eligible for Covered Connecticut. So while the premium tax credit from the federal government is going to cover this portion of the premium, the state of Connecticut is going to cover the other portion directly to the carrier. So you as the consumer aren't actually going to have to even make a payment for that. And all of your cost sharing is going to be paid as well. So all that information now, will become clearer to people, but they must come through Access Health, to enroll in it. But it is one of several programs, that people can be determined eligible for when they complete our application. Does that help?
Yes. Well, yeah. And so Covered Connecticut is a program by which some residents can be covered that's supported by the state, right?
Correct.
Yeah. But what I'm asking is, are we doing something to brand that term Covered Connecticut, or are we just simply continuing to brand Access Health Connecticut, and Covered Connecticut is just one of many sort of ways we can help people get their coverage?
Yeah, so are you talking more sort of like a logo or branding for the program, Paul?
Yeah. Well, yes, and messaging, yes, yeah.
So Paul, we are messaging it, and we are in the community knocking on doors, making people aware of this program that's available to qualified individuals and families, but we are not branding it. So it is not. We're not doing anything in terms of branding, but we are marketing it as another program, like no different than Husky. Husky is part of Access Health, but we don't brand Husky. It's just another program that's available to qualified individuals and families.
Right.
I hope
And
that
I think
provides a little clarity.
Just to chime in, this is Vicki, because the state has the control of the cover or administrative role with respect to Covered Connecticut. And it's a good question, Paul, and it's something that I can take back to the administration, the partners in the administration, as to whether we want to do something like that, given that, July is coming. And that's where we're expecting a bigger tranche of people to potentially enroll. And that messaging is obviously really critical, and we consider ourselves a partner in that messaging. And obviously it's a state program, and it will be evolving too. That's the other thing. So like Husky has evolved over the years, right? So I think there's a potential role there, and I will take that back to see if we should be considering something like that.
So James, in California, Covered California is the exchange, is it not?
Yes, they're part of the exchange.
Yeah.
That's
So
the
when you
name
say
of their
Covered
exchange.
California,
Yes.
so when you say Covered California out there, you're talking about the state insurance exchange, right?
Right. It's synonymous to Access Health Connecticut.
Yeah, right. And so that's why I'm just wondering, but it just, I think, I guess what it helps me is just to think that this is one of a number of programs like Husky, for example, where people can come and find coverage, whereas Access Health Connecticut is the marketplace, is the exchange, right?
Correct.
Yeah. Okay.
Thanks, Paul. Appreciate it. Carolyn, I'm gonna switch it back to you. You wanted to show us some examples.
Excellent. Thank you, Martin. Can you cue those up for us, please?
This is Access Health CT. It's where you can find all the help you need to enroll in health insurance that's right for you. It's where new financial help means lower cost. It's getting coverage when you have none or are between jobs. It's feeling confident and protected. It's having peace of mind. This is making health insurance available to everyone in Connecticut. This is important, just like you. Explore your plan options and costs at accesshealthct.com.
Este es Access Health CT. Es donde encontrarás el apoyo necesario para inscribirte en seguro de salud adecuado. Es donde su plan estará a costo más bajo. Es obtener cobertura
Subaru
cuando no
Canada
la tienes o
joins
cuando
us today at the Microsoft Executive Spotlight Series.
estás entre trabajos. Es sentirte seguro y protegido. Es tener paz mental. Esto le da acceso a seguro de salud a todos en Connecticut. Es importante, igual que usted. Explore sus opciones y costos de un plan en accesshealthct.com.
Thank you very much. So as you can see there with some of the visuals, folks, it's showing people at all life stages. We're making sure that we're showing all different types of people and really making sure that that message is focusing on lower cost. Terms like free actually didn't resonate very well in our focus group testing because folks felt like it was just too good to be true and they didn't even want to look into it. And so we're really making sure that we're balancing what we need to get out there into the market against the appetite of what folks in our target demographics are interested in hearing. So hopefully you'll see those as well as our PSAs out there in the wild. Very open to feedback if you have any as it relates there. And I just want to end here on a PR slide. Paid media is a really important part of getting the word out there, but so is earned media, right? Getting in the news. And so we've had a lot of really great success over the last couple of weeks with some awesome news segments. I have one front and center here. It was originally published by the Connecticut Mirror, really comprehensive, everything you need to know about open enrollment. That particular article was actually republished in the Hartford Business Journal, the Hartford Current, and while I don't have a logo up there, it was also in the New Haven Register. So big reach with that particular article. Ted Doolittle was in a great spot on News 8 last week, really thinking about some questions that folks should be asking while they're shopping for their health insurance plan. So big thanks to Ted for taking that opportunity. Really liked the NBC Connecticut spot in the bottom right corner of your screen. They did an awesome job with some graphics helping to showcase the different deadlines, right, and the effective dates. Enroll by December 15th for a Jan 1 effective date and enroll by January 15th for a Feb 1 effective date. Lots of broadcasts here, but also some more niche publications, including AARP. We've got patch publications that are picking up on all of our enrollment fairs and events where folks can get free in-person help. All the business journals in the state. James has been making himself very busy and available for radio interviews, which is awesome. And then we've got some Spanish coverage up there too, just to showcase that we are in multiple languages to reach all of our target demographics. This is not a holistic interpretation of all of the news coverage that we've gotten over the last couple of weeks. It's really just a splash slide here, but hopefully you can see there's a lot of noise, which is really excellent. So thank you for your time, unless there's any other questions. Hearing none. Oh, yeah, Vicki, hi.
Hi, good morning again. How are you? I had a question on the focus group. And it kind of goes back to this discussion we were just having, because, Covered Connecticut is absolutely free to people in these lower income bracket, like 160 or 175. How were the focus group members? Was anybody in that bracket? And I asked that because that's important for us for this discussion about branding and marketing to people who would have otherwise been on Medicaid, but for this program, right? So, it's a kind of a different message. I'm just trying to figure out how we navigate these messages going forward.
So we did have demographics of the uninsured as well as underinsured. So I don't know the exact FPL band of the folks that were in the focus groups, but I will definitely determine whether or not that's something we can find out and figure that out retroactively. But the overwhelming sentiment was, please give me information that's a little softer on the message. Tell me low cost. Tell me you're going to help me pay for it rather than calling it free. $0 went a little bit better. But we have to remember that focus groups are just that. They're not statistically significant and representative of the entire state, but it's a good pulse check on what our messages, and how they're going to resonate. And so we did, rejigger our messaging to make sure that we're paying homage to the feedback that we're hearing. That said, Vicki, I can go back and see exactly what we know about the uninsured and underinsured, and if we can get down to the income level, so we can kind of go back and look at their feedback. And we have transcripts.
Yeah, that's great.
So we can figure that out.
That would be great. I think that might be helpful for us on our messaging. I mean, even the zero cost versus free.
Yep.
That would be helpful. Thank you.
So Vicki, one of the challenges when people say, hey, something is free, it's almost too good to be true. And exactly. so they don't buy it. So we gotta get them to our website. Healthcare with lower quality healthcare. So again, these are all of the hurdles that we got to get people past to get them to get involved in Covered Connecticut.
Yeah, I don't disagree. Sometimes free does seem to be too good to be true. I agree with that. I'm just trying to use as much information as we can to kind of, if the state were to go back and do some additional, messaging itself, we would want to make sure we took advantage of the messaging or the information you already gathered. That's all.
Yep. We'll go through, we'll break it down, get it to you as soon as possible.
Thank you.
Okay.
Okay, thank you, Martian. If you would, I could just do a time check, make sure we're staying more or less on our schedule. And we need an outreach update is the next item.
Okay. So Charlie, we're going to do our best to finish around 10:30, so you have enough time for the executive session.
No, appreciate it. Just thank you for keeping us on track.
All right, great. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. So good to see you all virtually again. I wanted to start out with a general overview of our outreach efforts in regards to Covered Connecticut. To follow up Caroline's presentation, she outlined the significant efforts that marketing is using to reach our customers. For outreach, we're more at the granular level. It's more, in person, most times one-on-one conversations we're having with consumers and our community partners to raise awareness of the program, really working with the hardest to reach customers, honestly. So immediately after launch, we incorporated information about the program into all speaking points for our community events and presentations. And just to highlight some of the efforts to raise awareness to the Covered Connecticut program includes holding certified application counselors, or CACs, and broker trainings on the first week in July, right after launch. So they were able to educate customers on the benefits of the program very early on. And of course, we know CACs and brokers span throughout the state. We have included Covered Connecticut in all of our Healthy Chat presentations that we do to consumers and to our community partners. And during this presentation, we also cover topics such as American Rescue Plan and general information about Access Health. So as Rob stated earlier, we've had over 200 RSVPs to our chats. We've had about 27 this year. So these are very well attended. In addition, all of our Access Health brand ambassadors that attend and table our events in communities and our navigators were trained shortly after rollout to speak to customers about Covered Connecticut program and eligibility while in the field. And finally, we've shared our the program information with our partners as a part of our call-a-thon. Really, it's just regular outreach, providing them with general updates. And we're working with a list of over 1,600 community partners, so it's a significant outreach. And you know, our outreach is very targeted, so we know we are potentially interacting with individuals that may qualify. So our team has been through multiple trainings to prepare to share all this information. So it's really been a significant effort to educate not only our team, but the consumers at our events and our partners throughout the state about the Covered Connecticut program. And we will continue to do so moving forward. I can pause for any questions or I can move on to the next. Okay. So here's a visual of our outreach event. Oh, yep.
Oh, sorry. I'm not sure if you saw my hand, but
yeah. Sorry, I'm working with two screens here.
I apologize for interrupting you. I don't know if this is actually you or Caroline, so feel free to jump in, but because for the lay people on the call, outreach and marketing are related, not necessarily the same thing, but similar, right?
We work hand in hand.
Right. So I know that there's the outreach to the brokers, and I greatly appreciate the work with the community assisters and the navigators, particularly on Covered Connecticut, where I think that that's a huge piece of their work because they're deep in the communities. When you have those enrollment fairs, is there actual, I mean, is there enrollment going on with like a broker right there at the fairs so people can go right to a broker?
Yep. So at our enrollment locations and fairs, we have enrollment specialists. On our Saturday fairs, we have members from our customer resolutions team there, and we also have brokers throughout all of the events. So enrollments are actively happening in person.
Okay, that's great to hear. Thank you.
Absolutely.
I'm sorry, I should have probably asked that question for this guy.
Oh yeah, no, I would have covered it, but thank you for asking. Okay, so here's a visual of our outreach events and how we span across the state. There is constant outreach to communities with high uninsured rates, and as you can see, the events represented by the stars are really in concentrated areas with darker orange and reds, which are areas with higher rates of uninsured. So to date, we've had 90 events total covering 26 towns. And these are outreach events. We're not actively enrolling at these events, but they're informational. We're able to interact with customers, answer questions, educate about the different programs available. So we've maintained a presence in areas all over the state with a special focus on vulnerable communities. And we'll continue to do so during open enrollment to encourage consumers to enroll. So overall, it's really a tremendous effort from the outreach team as in-person events through the pandemic can be difficult to maneuver at times, to say the least. But we continue to go out, share information, and most importantly, maintain safety for our staff and consumers. I can move on to the next. Vicki, is your hand up again, or is that from the last call, from the last question?
The last one, sorry,
Okay.
apologies.
No problem. Just want to make sure I didn't miss you. Okay, so here I thought I'd outline all the resources we have for in-person enrollment help. Let's start with our enrollment locations. We have 3 locations open Monday through Thursday, various times as you can see, where we do have enrollment specialists as well as brokers to assist consumers with choosing a plan. Walk-ins are welcome to all 3 locations. Our November fairs are surprisingly wrapping up. Time flies when you're having fun. But our last fair of the month is this Saturday in Waterbury. And our fairs are typically on Saturdays. We do have one on Sunday in December before the Christmas rush. They run from about 10 a.m. to 1 p.m. And on site, we have enrollment specialists, we have staff from our customer resolutions team, and we have certified brokers available to assist in plan selection. So it's a much shorter event, but we do have more staff available to enroll. And to control the volume of people, we do encourage everyone to RSVP for our fairs specifically. This is just to limit the wait time, control how many people we have in the buildings, just maintain social distance when we can. And we also have links available to RSVP on our social channels and the website. And just to give you an idea of how customers are feeling, because I know we're still in this weird space of COVID. Last week, we collected surveys at our fair, and 94% rated their experience as excellent, giving us a 5 out of 5. It just speaks to how well planned and comfortable people are coming in to get the help that they need to enroll. Then we have our navigator sites providing year-round enrollment, and they also have certified application counselors in their office as well. And at times they'll host brokers to assist in enrollments at those locations. Finally, we partner with over 100 CACs, and we're up to 425 brokers at different locations throughout the state. So it's always a group effort to make sure our consumers have the help that they need. And all the CACs and brokers are listed in a directory on our website, so their information is very easily accessible. Again, both American Rescue Plan and Covered Connecticut materials are in the CAC and broker certification modules and assessment, which they have to pass every year. So everyone has the most up-to-date information to share with our customers when we are actively out in the communities. And just to wrap up here, these are the rest of the fairs. Again, they typically run on the weekends, Saturdays, until the end of open enrollment, excluding holiday weekends. Again, walk-ins are welcome, but we do encourage RSVPs. Individuals can RSVP from events on our Facebook or through our website. And I can't stress enough how well set up our fairs and locations are. Offering plenty of space for social distance, little wait times. Everyone is required to wear a mask. We are also working with, we continue to work with DPH to get vaccine cards at some of the locations that we can accommodate, but we are careful about the number of people in the room at a time. And finally, I just wanted to point out here a picture of James and I at one of our navigator locations. We were able to visit our enrollment location sites as well as get tours of our navigator offices. My first time seeing the locations and how all the planning, really came together. And I've also been attending the fairs on Saturday. And just seeing the consumers get the enrollment help that they need is so rewarding. Most come with their spouses or other family members with folders of documents, and they're so grateful for the one-on-one help. It really reinforced why these events are so necessary, and our team really worked hard to make it happen this year. So, we continue to stay flexible, find new ways of educating and enrolling consumers, especially those in vulnerable communities. We know they're hard to reach. And we'll continue to do that as we've always done. But that's it for outreach updates for today. Thank you for your time, and I'm open to any questions you may have.
I think Matthew has a question. Thank you for that. And Matthew?
Yeah, thank you. Just one, I love the sort of partnering with the community organizations like Waterbury now and libraries. Do we partner with any school districts though? Like I'm wondering if we partner with, say, the East Hartford Public School System to do a fair that probably gets us to a good chunk of people who we're trying to find.
Yeah, so this year we actually have a lot of opportunities to partner with school districts, and we actually do that during the year with different outreach events, not enrollment events, but we do with our outreach tour events. But the difficult part this year was staffing. And so, even if we could do an enrollment event at a school district, it was a matter of having the staff present to do the enrollment because we need specific staff. It's not like our outreach tour events where it's just informational and answering questions. It's in depth, and so we need enrollment specialists, we need brokers. So the planning is a little bit different, but we do partner with school districts throughout the year for just general outreach events.
So just is that a financial issue in terms of the staff, or is that we can't find the people in terms of the staff?
Well,
like how do we?
Well, Matthew, every year when we do open enrollment, we partner with our call center vendor because they have trained staff on how to enroll people into our system. This year, we've reached out to them a number of times, and we offered extra money. Folks just did not want to do it. And also, the call center is short staffed, right? And they're about a third of what they normally are for the work they do for us this year. And we did a lot of outreach, we had in-person meetings with the staff. Folks were just not interested in going out into the community. And last year we had similar challenges last year. So again, this is all impact because of COVID, obviously, because prior to last year, we never had any issues at all getting people to come in and work in our community events.
And
so it's not a money issue.
Yeah.
It's just a willingness by employees, typically with our call center. So right now we've been staffing them with our own staff who used to work for the call center. We've hired them over the years. So we're finding a way to make it work, but we could do a lot more with just staffing. And as Tammy indicated, we need people who could actually enroll people into our system.
Right.
Experienced folks who know our system.
And typically when we do get visitors at our enrollment fairs and locations that require that in-person help, they do require more attention. And so we are very particular with who we have at these enrollment sites to get people enrolled. We want them to have the best experience in person. So we do take better care. And just to outline, on the events, the outreach tour events, we've actually doubled those this year as opposed to last year to kind of compensate for not having as many enrollment opportunities. So we are educating people and pointing them to the right direction. They're going to the website, they're calling the call center, they're going to CACs and brokers. So we've worked around that a bit, but yes, we do partner with school districts.
Matthew, just in closing very quickly, as I indicated earlier, right now they're remaining uninsured. Most of them are the hardest to reach.
Yeah.
And also they probably lack the largest amount of trust in terms of people coming in offering them stuff. So that's why the in-person is so important.
Yeah. Agreed.
Right. So we'll continue to push that, and hopefully when this thing is behind us, we could ramp it back up, go into
Yeah.
communities in full blast and get more people enrolled.
Thank you.
Yeah, James, I can't offer enough support for all this in-person, all these in-person activities, because it says something about who we are as a brand, who we are as an organization. And as important as all the technology is, I think in this space, you really need to have some high touch, kind of outreach as well. And to Tammy and everybody else that's persevering on all of this in-person stuff in the face of this pandemic, thank you very much for everything that you guys are doing. But I really think once we're through the pandemic, I hope we'll even expand on some of these activities.
And Paul, one final comment about that. This is why the Broker Academy is so critical, by recruiting, developing, training folks in the urban communities where we know the uninsureds are highest and the mistrust is highest. But by having community licensed and certified brokers in those communities where that could become trusted resources for those communities, will help us address some of these challenges.
Yeah.
And currently there aren't too many brokers in the communities of color, in the urban communities. So we think that this effort would help address some of these challenges.
Great.
All right, thank you. Now, the financial update, please. Thank you.
Good morning. My name is Daryl Jones. I'm the Finance Director for Access Health. This morning, I'm going to present to you year-end results for fiscal year 21. I'm also going to present to you first quarter results for fiscal year 22 and the fiscal year 22 proposed adjusted budget. These presentations were made at the Finance Committee on November 12th. Both fiscal year 22 reports were presented to the Finance Committee and were approved. Therefore, I'm going to give you key highlights from the presentations. Next slide. With regards to the American Rescue Plan, $307,000 will be reimbursed through the CMS grant awarded in September of this year to Access Health. Next slide. The fiscal 21 actuals ended in an under budget of $1.3 million. Next slide. This slide shows the detail of the savings due mainly to the impact of the pandemic. Next slide. With regards to the reserve fund projects, I want to highlight the vaccination initiative projects, which was in collaboration with the Department of Health. Here we spent $4.9 million through our vendors for these initiatives. And Access Health has so far been reimbursed 92% of the $4.9 million by the Department of Health. Next slide. And $1.05 million in projects started in fiscal year 21 were carried forward in fiscal year 22. And these projects are expected to be completed by the end of this fiscal year. Next slide. So now I'm going to turn your attention to the fiscal year 22 budget summary. Next slide. Next slide. So at the end of first quarter fiscal year 22, we were under budget by $1.8 million. And our proposed fiscal year 22 adjusted budget is increased by $1.1 million. Next slide. With regards to first quarter, the under budget is due to timing. Projects and contracts are just commencing during the first quarter. When we complete 6 months of actuals, we'll report back any variances to the board. Next slide. With the fiscal year 22 adjusted budget, the 1.1 million proposed increase is a result of two initiatives. The award of CMS grant of $1.1 million in September. This grant will fund 6 projects over the next 2 fiscal years. Next slide. The second is for Cover Connecticut, where we are increasing the budget by $643,000 to cover marketing, outreach, and technology investments. In addition to the increased budget for Covered Connecticut, Access Health has committed internal resources such as marketing, legal, operations, TOA, finance of over 800 hours to support Covered Connecticut. Next slide. This slide is details of how the increase is accounted for in our fiscal year 22 adjusted budget. Next slide. And finally, we are projecting our reserve fund balance at the end of this fiscal year 22 to be at 20.1 million, which is roughly 7.3 months of operating funding. Next slide.
That's the end of the finance presentation.
Do you have any questions? Happy to answer them.
Charlie, I just want to remind the board that our fiscal year is from July 1st, 2021 through through June 30th of 2022. So our first quarter ended in September 30th. Just for context of where we are.
I appreciate that, which explains some of the timing points that we just saw.
Right.
All right. Thank you. Thank you for the report.
Mr. Chairman, there's a series of votes to be taken.
Yes, I think there was a question first, and then we'll take the votes.
Thanks, Mr. Chair. It's Deidre.
Deidre.
Just something to put on the radar screen. And by the way, Martin, I'm here. I showed up late, so just for the record, I got here about 9:30-ish. You know, James and Daryl, I'm wondering on Covered Connecticut, if you and DSS have talked about a cost allocation methodology for the administrative costs. I don't know that it will apply in fiscal 22 because there is no associated Medicaid benefit with the Covered Connecticut program right now. It's fully a supplement. But once assuming we get the waiver approved for the next fiscal year, the out-of-pocket costs will be covered, we hope, by the Medicaid program and not the state. And so there may be, we would need to talk to CMS, but there may be a way that some of the administrative costs associated with the development work that has to go on for Covered Connecticut could be defrayed by getting Medicaid match on a portion. So we'd have to wait for our waiver to be approved, I think, for that to happen, but I'm putting it on all of our radar screens because it's probably a conversation we should engage in. And see if there are any matching dollars that might be available, dependent on the waiver being approved to get Medicaid match for those out-of-pocket costs.
Thank you, Commissioner. We'll make a note of that. We'll follow up with your finance team. Darryl meets with your finance head every quarter, sometime on a monthly basis. So we will discuss that and keep it in both of our radars going forward. Thank you.
Yeah, you're welcome.
Thank you.
Great catch. I think that's terrific. Thank you. The votes now, Martin. Can you lead us through them?
Yes, Mr. Chairman. Chair will request a motion to approve the fiscal year 2022 Q1 budget report as presented. We're asking for a motion.
Could I have a motion, please?
So
Tom
moved.
McNeil, so moved.
Matt
Second.
Bracknell, second.
Thank you. Roll, Klippel, yes.
Okay, Paul Philpott,
Yes.
Claudia Gaultieri, Deidre Gifford,
Yes.
Ron Ritter,
Yes.
Steven Hernandez, Sean King,
Yes.
CC Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Veltri,
Yes.
and Matthew Brackman.
Yes.
Thank you. And there's an additional vote. Chair will request a motion to approve an additional expense of $643,209 for Covered Connecticut program costs to the fiscal year 2022 operating budget. Their motion?
Yes, can I have a motion to support that?
Tom
I'll
McNeil,
make that
so moved.
motion. Okay, I'll second it. Tom moved it.
Thank you both. Charlie Klippel, yes.
Paul Philpott,
Yes.
Claudia Gaultieri, Deidre Gifford,
Yes.
Glenn Ritter,
Yes.
Steven Hernandez, Sean King,
Yes.
Cece Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Valtry,
Yes,
and Matthew Brackman.
Yes.
Thank you. And now another vote. Chair will request a motion to approve a transfer of $643,209 from reserves to fund the Cover Connecticut program costs. Is there a motion?
I'll make that motion.
Okay.
I second it.
Thank you.
Okay. Roll call. Charles Klippel.
Klippel, yes. Yes.
Paul Philpott.
Yes.
Claudia Gaultieri. Deidre Gifford.
Yes.
Glenn Ritter.
Yes.
Steven Hernandez. Sean King.
Yes.
Cece Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Valtry.
Yes,
And Matthew Brackman.
Yes.
Thank you. Appreciate it. And now the last vote for finance. The chair will request a motion to approve an additional expense of $533,000. Sorry, for $533,000 and $334 for IT security projects and application system enhancement costs to the fiscal year 2022 operating budget. Is there a motion?
I'm sorry, can you say that again?
Repeat the vote, please.
Chair will request a motion to approve an additional expense of $500,033 for IT security projects and application system enhancement costs to the fiscal year 2022 operating budget.
Mr. Chairman, just so to remind the board, this is for projects that are funded by the CMS grant. But in order to spend the money, we need the authority in our budget to spend it. But this is all funded from the CMS grant we got. We received it we received the approval in September from CMS. And these are projects that were identified to CMS. If we got funded for it, we would do them. We got funded for them, so now we want to add them to our budget now because they weren't part of our original budget.
And what is the? Sorry, Charlie.
No, so this is spending the additional money that we received from CMS to enhance our system security and some functionality. Is that correct?
Correct.
Okay, I think.
And as James mentioned, sorry, Charlie, that they weren't expenses that were in the approved budget for this year when it was approved in spring of 2021.
So we're sort of putting them into the budget now, and that's the motion on the table.
Correct.
Okay. I think people sort of, at least speaking for myself, you bring this back into my consciousness. So you're catching us a little bit, but I think I understand now the context. I don't know if there's any discussion. I think it makes sense that we add this to the budget, given that we have received the money to do so, and we just need to sort of formalize that, as I understand it. So
correct. That's correct.
Okay. Could I let stop for a moment for conversation? Otherwise, can I get a motion to do that?
so moved.
And I will second, but I just need the amount. I didn't clearly hear the amount.
Sure, it's 533,334.
And the commission.
33,000. Sorry, that 533,000 or 500,033.
533,000.
533,000. Okay, got it.
We have
Thank you.
34.
My
Sorry.
apologies.
No problem.
And Commissioner, some of the grant money was spent last year to implement the American Rescue Plan, about $307,000 that Darryl mentioned. The balance will be spent in next fiscal year's budget. So we would include that in next year's budget.
Okay.
Now you've confused me. So this is an add to the current fiscal year budget?
Correct.
Okay, all right. All right, well, I think we have a motion, a second, so Clipple, yes.
Okay. Paul Philpott,
Yes.
Claudia Gualtieri, Deidre Gifford,
Yes.
Frank Ritter,
Yes.
Steven Hernandez, Sean King,
Yes.
CC Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Veltri,
Yes.
and Matthew Brackman.
Yes.
Thank you.
Okay, next, an audit update.
Thank you, Mr. Chair. To update you, as I believe James and Daryl have mentioned, there was a meeting of the audit committee last week, and at that meeting, our outside auditors, Clifton, Larson, and Allen, and we have Nicoletta McTighe and David Flint on the phone with us today to answer any questions. Presented the FY 2021 financial statements and FY 2021 programmatic audit. These are requirements under the ACA, and also the financial statements are a requirement for us as a quasi to have these annual independent audits. The programmatic audit looks at our compliance with requirements as an exchange, eligibility and enrollment, and a number of other items. So these audits were completed. They were clean audits. There were no findings or recommendations. And last week, the audit committee voted to recommend to approve them, to the full board. And that is why we are bringing the vote to you here today. And you all should have received copies of these audit reports with your board materials. So if you have any questions, Nicoletta or David or myself can answer any questions.
Okay, hearing none, Marcin, can you frame the vote?
Yes, Mr. Chair, we'll request a motion to approve the fiscal year 2021 AHCT audited financial statements as presented. Is there a motion?
So move, CC Woods.
I'll second.
Okay.
Thank
Roll
you.
call.
Clipple, yes.
Okay. Paul Philpott,
Yes.
Claudia Gualtieri, Deidre Gifford,
Yes.
Frank Ritter,
Yes.
Steven Hernandez, Sean King,
Yes.
CC Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Veltri,
Yes.
and Matthew Brackman. Mr. Brackman? Okay. And we do have additional vote. Chair will request a motion to approve the fiscal year 2021 programmatic audit report as presented. Is there
Do
a
you have a
motion?
motion?
So
So
moved,
moved.
Tom McNeil.
Paul, I'll second.
Thank you. Clipple, yes.
Okay, Paul Philpott,
Yes.
Claudia Gualtieri, Deidre Gifford,
I'm going to abstain because I think I missed that part of the presentation.
Frank Ritter,
Yes.
Steven Hernandez, Sean King,
Yes.
CC Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Veltri,
Yes.
and Matthew Brackman. Thank you so much.
And then finally, just to give you a brief update, if you could go back to the slide, Martin, as I know we are long on time, go back to the audit slide, please. As I know we're, running a little long on time. Also, just to give you an update on the SMART, which is the state-based marketplace annual reporting tool. And this is a tool that CMS created for exchanges to have, in addition to the programmatic audit and the financial audit, one-stop shopping for all of our requirements so that we can confirm to CMS that we are complying with all of our requirements. And the SMART has 4 components: eligibility and enrollment, the financial and programmatic audits we just mentioned, program integrity, and finally an attestation of completion. So we filed our SMART for 2020. It goes on a calendar year basis on June 1st. And on September 27th, CMS issued its SMART summary of observations and action items for AHCT. CMS did not identify any action items for this SMART filing. So if there aren't any questions, in the interest of time, I'll move to my next brief update. Just to fill everybody in, is that okay, Charlie? Or we can
Absolutely.
skip
I
it.
just want to say congratulations on no findings, but keep moving.
Thank you. Thank you. Just to give you a brief update, as people are probably reading in the news, Build Back Better is very active down in Washington right now. It looks like the House is going to vote this week. It looks like the CBO has been issuing the scores that were requested by various members of Congress. And I think they're going to have all of the information in by Friday. So they're hoping to have a vote in the House by the end of this week, perhaps, and then it would go to the Senate. And just high level, the healthcare provisions, the ACA provisions are still in the bill, and these include extension of the premium tax credit expansion that has been wonderfully helping consumers from the American Rescue Plan Act, and it would extend those benefits through 2025. Also extending the subsidy enhancement for individuals receiving unemployment benefits to 2022. In ARPA, that was only for 2021. It also includes provisions for the Medicaid coverage gap, which is primarily focused on non-expansion states that did not expand Medicaid, which Connecticut has, but it would actually apply to all states, and it would provide Medicaid, provide coverage for those below the poverty level, heavily subsidized coverage through an exchange if they were not able to enroll in Medicaid for 2022 to 2025. There's also a proposal on the employer firewall, which is relates to the affordability component. If someone is offered employer coverage, about whether it's affordable, which would make them either eligible or ineligible for APTCs. And the proposal is to change that from 9.5% of income for premium down to the 8.5% that's in the American Rescue Plan Act as the cap from 2022 to 2025. There's also funding for states to increase affordability, a $10 billion fund for states for each year from 2023 to 2025 for either reinsurance and or to reduce premiums and cost sharing costs for consumers. Also funding for 1332 waiver applications, $50 million for administration and planning grants for states to apply for those waivers if they choose. Also adding new hearing benefits for Medicare. And then finally, they are also looking at insulin caps, similar to the insulin caps that the state of Connecticut has passed, but slightly less rich, I believe. So I'll pause.
So Susan, it'd be great to know, and I don't think we know yet what is in the affordability fund what they're looking at for numbers for each state, at least in the version I read.
Right.
But it'd be nice to know. It will be good to see what happens with that fund because of the things we've been considering as a state. But
exactly, and it very much aligns with Covered Connecticut and other initiatives to reduce costs for consumers.
Charlie, we do have a lot of inside information from different sources. So as this evolves, as the information becomes clearer for us, and if it happens between now and January, we will send a report to the board. We'll send a written report to the board so that the board could know exactly what's going on and potential impact to us and our customers.
No, that's fantastic. This is another major moving piece. And so I think, and Susan, your summaries are always super helpful. So I think if you could do that, that would be great. Appreciate it.
Absolutely. Thank you.
James, I think this is back to you.
Actually, this is very quickly, just a quick update on the items. Most of them are the items that we are working on with the strategy committee, looking at our broker academy, looking at subsidiary, and also other changes that may impact us going forward as they become clearer to us. So with that said, Mr. Chairman, that is it.
Okay. Just before we, I think we're at the point of closing the meeting. I have asked for a brief, and I will make it brief, executive session, but I really do want to express appreciation for the engagement, particularly around Cover Connecticut. So if I feel like I'm a shinekeeper here, but I really do like the time we devote to discussions like Cover Connecticut, because I think getting that message out there, getting it right, but also making it simple so that people are understanding that it's not a separate program, it's automatic for the exchange. I think it's going to be so important and a little tricky to get it right? So so Vicki and Matthew and Paul and everybody who commented on that today, I think it's really important to keep that discussion going. And I appreciate the use of our time. I hope you all do to try to advance that ball and make it as crisp and clear and effective a program as we can for the state. So thank you. With that, sorry, any comment? And then with that,
Oh, no, sorry, Charlie. I just didn't know if we needed a motion. I think
no
we need a
problem. Go
motion.
ahead.
I think we need a motion to go into executive session.
Yes, we do. And Chair will request a motion to go to the executive session to discuss the evaluation of a public employee, public officer or employee, a matter exempt from disclosure pursuant to Connecticut General Statute 1-200 parentheses 6 parentheses A. Is there a motion?
Yeah, I'll make that motion.
Thank you. Second?
Second.
Thank you.
Okay.
Klippel, yes.
Okay. Paul Philpott,
Yes.
Claudio Gautieri, Dietrich Gifford,
Yes.
Ron Ritter,
Yes.
Steven Hernandez, Sean King,
Yes.
CC Woods,
Yes.
Thomas McNeil,
Yes.
Victoria Veltri,
Yes.
and Matthew Brackman. I just want to make one statement. Members are asked to disconnect from the regular meeting line and connect to the executive session line. After the conclusion of the executive session, members will be asked to disconnect from the executive session line and reconnect to the regular meeting line to adjourn.
Thanks.
Thank you.
Oh, I'm glad you explained that because I would have gotten that wrong. All right. So if you would all join me, or if all the executive committee would join me for the executive session on the other call-in line. Thank you so much.
Excuse me, Charlie, I think you're still showing up in here.
We're just waiting for the quorum to be back.
They know they have to come back. People may have gotten up for a bio break or something, but they're coming.
Okay, thank you.
Okay.
How close are we to a quorum, Martian? Do you know?
Yeah,
We need 2 additional voting members. We got 4 and we need 6 to have quorum.
Okay.
I would say somebody's having trouble getting back in.
Right.
Yeah, I think we have 5, Martin, 5 voting
Yeah,
members,
Sean-
and I
Sean
think we
did.
just need the
Here.
chair, right? We've got Sean, Vicky, Paul, Cece, and you, Grant. So I think we just. Yep. And hopefully, obviously, Mr. Klippel can come back. So we've got our chair.
Thank you, Susan.
Nice weather we're having today.
Uh-oh, yeah.
It is true.
Yes, it's right. The one warmish day.
Yeah,
And I
60
think it's
something
going back the
degrees.
other way.
Right, it's over 60. It's supposed to be in the 40s tomorrow, I guess.
There we go.
Yay.
No?
Has somebody contacted Charles?
I did. I sent a message over to try to find out what's
Yeah.
going on.
All right, here I am.
Oh, okay, here we go.
Oh, Deidre's here.
Is that enough
right.
now?
That's. It would be
I
good to
believe
have a-
It's enough. Do we know if Mr. Klippel can join us back as the chair? Does anyone know?
He said he was coming back, didn't he?
Okay.
Yeah, he was coming.
I think we just got an email.
We did. Yeah, he sent out an email to the group. He's got apparently he's saying, I believe we lost our connection of the meeting. The only remaining agenda item is to adjourn. Marson, can we do that by written consent? He says.
Or can we just vote for somebody to chair to then adjourn?
Sure. You
Susan?
could just, yep, you
Well-
could just vote, Paul as the vice chair to just
Okay.
chair this last vote and then vote.
Okay.
Yeah.
Okay, so the vice chair is asking for a motion to adjourn.
So moved.
Seconded, Grant.
Second. Oh, yeah, okay.
Okay. Obviously, Mr. Klippel is not here, so Paul Philpott,
Yes.
Claudia Goltieri, Deidre Gifford,
Yep.
Juan Ritter,
Yes.
Tiber Hernandez, Sean King,
Yes.
CC Woods,
Yes.
Thomas McNeil,
You didn't make it back.
no, Victoria Vertree,
Yes.
and Matthew Brackman. Thank you. Meeting has adjourned. Motion passes.
Thank you very much.
Thank you.
Hey.
Thank you.
Have a great day.
Thank you.
Thanks, everyone.
Enjoy the
All
weather.
right, bye-bye.
Lord.